avascular necrosis? I've been asked that question, and it is when a bone in your body starts to die because it loses its blood supply. So avascular means no blood, necrosis means to die. The most common bone in the body for this to happen to is your femoral head, which is your hip bone. There are many reasons this can happen. One can be that you broke your hip, which then disrupted the blood supply. Another one is you dislocated your hip, which can disrupt the blood supply. If you have a history of alcoholism, that can cause the hip bone to die. Very high doses of oral steroids over long periods of time can cause the hip bone to die. Certain types of cancer, radiation treatment. So there's a large variety of reasons why you can get avascular necrosis. The most common bone in the body for this to happen to, again, is in the hip or the femoral head. You can also get it in the elbow or the knee. Those are the three most common places to get it. I'm just going to show you what it looks like. This is an MRI scan of two hips. This hip is normal. This has no evidence of osteonecrosis at all. This is a normal looking hip. Now look at this hip. You can see the difference between the normal hip and the one with also what we call AVN, also known as osteonecrosis. The hip bone has collapsed. You can see there's the color is not homogeneous in the hip area. The joint space is very incongruous. It looks very rough. There's a big bone spur in this region. AVN of the hip is a condition that is typically treated by hip replacement surgery. If you catch it very early, there's a procedure called a core decompression, where we drill some holes in the bone, which can stimulate some new bone or new blood vessels to come into that area. On occasion, a bone graft that has a blood vessel attached to it can be put in the area of the hip to regenerate that hip bone. But most of the time, AVN is a progressive problem that ends up with you needing a hip replacement.